Good, happy Monday evening, March 16, 2020. I'm Riley King, and welcome to this evening edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Monday evening, so let's begin. First up, White House announces tougher guidelines to slow coronavirus spread. Here is the latest for all of you. There are more than 168,000 coronavirus cases in 148 countries and territories, according to the World Health Organization. More than 6,600 people have died worldwide. In the United States, there are at least 3,400 cases in 49 states, Puerto Rico and the U.S. Virgin Islands, and Washington, D.C. At least 65 people in the U.S. have died. President Donald Trump declared a state of national emergency in response to the outbreak on Friday. Several states are closing bars and restaurants, but encouraging restaurants to offer takeout and delivery only. The Center for Disease Control and Prevention is recommending organizers cancel or postpone events in the U.S. that consist of 50 people or more. Canadian Prime Minister said he will close his country's border to non-citizens. DHHS, person under 18 years old, among 4 new presumptive COVID-19 cases right here in New Hampshire. 17 COVID-19 infectionists identified in New Hampshire. Governor orders New Hampshire restaurants, bars to close except for delivery and takeout. Move follows similar order in Massachusetts ahead of St. Patrick's Day. Governor Chris Sununu is calling on New Hampshire restaurants and bars to close except for takeout, delivery, or drive-through services in an effort to slow the spread of COVID-19. The order will take effect after the close of business Monday night. The move follows a similar order that will be in effect starting Tuesday in Massachusetts. A spokesman for the governor said there was ongoing concern that St. Patrick's Day revelers who couldn't go out in Massachusetts would head north to New Hampshire, potentially hosting the spread of the coronavirus in the Granite State. In addition, all public gatherings of more than 50 people are prohibited. Sununu said the order will remain in effect until April 7th. COVID-19 coronavirus in New Hampshire. What you need to know. Official detail, symptoms, and number of cases. 17 Granite Staters have tested positive for coronavirus disease, COVID-19, which was first detected in Wuhan City, China. New Hampshire data. Number of positive COVID-19 tests, 17. CDC has confirmed 2 of them. Number of pending COVID-19 tests, 195. Number of negative COVID-19 tests, 355. Number of people positive tested, 567. Number of people being monitored, 534. On March 11th, 2020, the World Health Organization declared COVID-19 outbreak a pandemic. On March 13th, 2020, Governor Sununu declared a state of an emergency, which ensures resources will be ready so the state is able to respond quickly as needed. The patients in New Hampshire. Let's take a look. Patient 1. Patient 2. Patient 3. Patient 4. Patient 5. Patient 6. Patient 7. Patient 8 to 13. All 13 patients have not been hospitalized and are resting at home with mild symptoms, health officials said. Symptoms. Officials said symptoms might appear in as few as 2 days or as long as 14 days after exposure. Symptoms include fever, cough, and difficult breathing. According to the CDC, emergency warning signs for COVID-19 include difficult breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, and blush lips or face. Protecting yourself. Preventing the spread. Schools. Governor Sununu on March 15th ordered all K-12 public schools to close. Remote learning must begin through those schools by March 23rd. Schools will be closed at least April 3rd, or maybe longer. The order does not apply to private schools, though officials said many are following suit with similar plans to close schools and pivot to online instructions. Sununu put forth directives that help families affected by school closures, including parents forced to miss work to care for their children at home can access state unemployment benefits. Children care across will be expanded for workers unable to stay home while schools are closed. More information can be found here, and we will share this link with you on the Riley King Network Facebook page after this broadcast. How testing works. Insurance information. New Hampshire Emergency Operations Center now open. The center will be open from 7 a.m. to 7 p.m. And COVID-19 in New Hampshire. 17 number of people in New Hampshire who have tested positive for COVID-19. 179,073 number of people worldwide who have tested positive. 0 number of deaths from COVID-19 in New Hampshire. 71 number of deaths from COVID-19 in the United States. And 7,074 number of deaths from COVID-19 worldwide. There are 5 in Grafton County now, 1 in Carroll County, 10 in Rockingham County, and 1 in Hillsborough County. The common symptoms: fever, cough, and difficult breathing. How it spreads. And prevention tips. We are all in this together. Governor details plans for schools and daycares. Governor Chris Sununu answers questions about the state's response to the spread of COVID-19. New Hampshire's governor on Monday expanded upon the state's response to combat the spread of the coronavirus disease, COVID-19. In an interview with WMUR, the governor touched on the state's move to close all public schools in order them to shift toward online learning. All public schools beginning Monday and need to begin online courses by March 23rd. The goal is in the next few days to get everyone across the state where they need to be, roll it out over a few weeks, and then we'll recess, Sununu said. It's being rolled out very well so far. There are still a lot of hurdles to jump through, but so far it's going very well. Remote learning will continue for 2 weeks until April 3rd and could continue after that time. In the meantime, we're going to have a fund set up to clean schools. For example, we want kids going back to a clean, healthy environment. Give confidence to parents that is going to be taken care of, Sununu said. The governor issued directives aimed at taking some of the burdens off parents affected by the move to close schools by opening up unemployment benefits to them. The benefits will also be in place to help people in quarantine. Additionally, if new federal legislation designed to expand paid leave options doesn't reach certain granted status, unemployment benefits are a possibility for them, too, Sununu said. Whatever we do, we're really making sure we're streamlining the process so people have a very easy access to it. It shouldn't be something that we're struggling through, Sununu said. We know there could be a big run on the system. A lot of folks may be applying for this at any given point. So we want to make it easy for folks to get these benefits. For workers who can't get time off to care for their child care options have been expanded in the granite states, Sununu said. The options include the state is flexing licensing requirements so businesses can allow workers to bring children to the workplace. The state is also allowing daycare centers to expand the number of child they currently accept within reason. We're providing guidelines to all these facilities in terms of screening, Sununu said. We're recommending that they do either taking a temperature or a quick survey to make sure that the kids, even they may not be symptomatic. We're at least getting an understanding of what their potential contact points might be. We are all in this together, Sununu continued. We need folks to really help us step up and be a part of that solution, and they are. Across the state, we're seeing a lot of positively from folks saying, yes, we're willing to do this. If we can provide the guidance and that runway, they can get it done. One step other states have taken is to limit the size of gatherings allowed in the state. The Centers for Disease Control and Prevention weighed in Sunday night, implementing in a recommendation that no events with more than 50 people be held for the next 8 weeks. Sununu added that store shelves of which have been bare in many supermarkets and stores across the state will continue to be restocked. Pinkerton Academy hands out Chromebooks to prepare for remote learning. Schools across New Hampshire closed to limit spread of COVID-19. Let's take a listen to that video from WMUR News 9, Ray Brewer.
At Pinkerton Academy Monday morning, they were handing out Chromebooks, part of the school's plan to deal with the coronavirus as they prepare to take their classes online. This comes as they learned over the weekend that a person at the academy had tested positive for COVID-19, prompting an immediate response.
We go through the CDC recommendations and guidelines for cleaning and what we should do along those lines, so we're making sure that we're following that and going beyond.
The headmaster says that the staff worked through the weekend to start putting remote learning in place, although exactly what that will entail will evolve over time.
It'll be some where they post instruction, they'll use videos, and they use different ways to communicate and to conduct discussions and things like that with students.
The Chromebooks are being provided to any student who needs one. While the classes aren't online yet, parents approve of the school's decision.
I think it's really good so our children don't fall further behind, and it helps reduce their risk of getting ill and bringing it home to other people.
I think it's a great solution to what they have to do. It's going to be difficult for them, I think, but it's the only solution I think they have right now.
Still, everyone is acknowledging that there will be a period of adjustment. The headmaster says he's already been in contact with the state about the coronavirus and ways to deal with it. He says those who are at highest risk will be contacted directly by the state. But if parents have any questions, they can always call the school. Reporting live in Derry, Ray Brewer, WMUR News 9.
Okay, there you go on that video and that report. Canada closes borders to non-citizens. Americans exempt. Flights to Canada restricted to certain airports. Coronavirus in Massachusetts, Monday, March 16th, update. New cases, 33. Total cases, 197. And source under investigation, 51. MBTA announces schedule changes for subways, buses, commuter rail, and more. Coronavirus in Maine. More cases announced. State of emergency declared. Let's take a listen to that video from WMTW News 8 Maine.
What would you do with a few extra hours?
Good afternoon. Yes, Nirav Shah just spoke to us, and we are learning that there are 5 additional cases. So the total number of cases is now 17. The majority of those are in Cumberland County. And he said one of the biggest problems is that many of those are community spread. He said that's one of the main concerns right now. The big concern with that is he says the number is expected to rise. But it is important. He did want to touch on the number of tests that have been negative so far are over 700 tests. And since the beginning of this, they have gotten over 1,600 requests just for consultation. So it seems like people are really heeding the warnings and listening to the CDC. He says over 180,000 people have visited the website so far. He right now says that they're asking for more protective equipment from the federal government. So that includes things like gloves, shields, and masks just to protect the workers who are working with the sick right now. And of those 17 cases, 2 of them are hospitalized. And he says that's pretty standard with what the statistics that are showing around the world. The issue with this, he says the models are changing on the hourly basis, so it is tough to keep up with, but he says he will be releasing more information. And he ended it on an important note that I think should really be touched on, and it kind of goes off of what Governor Janet Mills was saying about being prepared and respond and not to panic. He says everything before seems like an overreaction, and then everything after seems like it's inadequate. Of course, we will have more updates as they come in from the CDC. But for now, live in Augusta, Alison Ross, WMTW News 8.
Okay, and there you go on that video and that report. And now let's take a look at your U.S. stock market and see how your U.S. stock market closed for this Monday evening. Your Dow Jones Industrial Average closed in the red and went down. Your Nasdaq closed in the red and went down. S&P 500 closed in the red and went down. Gold closed in the red and went down. Oil closed in the red and went down. U.S. 10-year closed flat. Euro/USD closed in the red and went down. And VIX closed in the green and went up. It was not a good day in the stock market today. Dow drops nearly 3,000 points as coronavirus collapse continues. Worst day since '87. Stocks fell sharply Monday, with the Dow suffering its worst day since the Black Monday market crash in 1987. And its third worst day ever. Even after the Federal Reserve banked on a massive mandatory stimulus campaign to curb slower economic growth aimed at the coronavirus outbreak. Healthcare workers on coronavirus front lines start to test positive. Let's take a listen to that video from Good Morning America, ABC News.
The spread of the virus in the U.S. has been dramatic. Take a look. Just 2 weeks ago, there were 80 confirmed cases in 10 states, and now there are more than 3,700 cases in 49 states, all but West Virginia. Healthcare workers are now also starting to test positive. Eva Pilgrim is at Lenox Health Hospital here in the city. Good morning, Eva.
Good morning, Robin. Hospitals all across the country are battling this virus and preparing for it to get worse. Here in New York City, all hospitals will now be canceling, postponing those elective surgeries to preserve resources, beds, equipment, and staff as they get ready for the crush of patients that could potentially come in. This morning, hospitals on the front line of the fight against coronavirus bracing for a possible spike that could overrun the healthcare system. In Boston, they're reassessing their supplies, gloves, masks, ventilators, preparing for the worst.
We're also setting up other testing sites, what's called alternative sites of care, to make sure that we can test patients and so that patients with mild illness don't come into the hospital.
As healthcare workers try to help the patients coming in, multiple workers at Brigham and Women's Hospital have now tested positive for COVID-19. The hospital contacting all patients and staff who may have been exposed. In Ohio, a nurses union is demanding more protective equipment to safeguard against infected patients.
We are very concerned that when this virus peaks, that we have enough of this equipment for our nurses to take care of our patients properly.
The number of healthcare workers testing positive for COVID-19 is growing. A National Institutes of Health employee, a healthcare worker in Newark, New Jersey.
This obviously becomes a risk when it happens more and more often because the supply of healthcare workers is, of course, affected. If you start quarantining more and more folks on the front lines who see patients, that becomes a risk in and of itself.
And multiple caretakers in that nursing home in Washington. Now some are calling for more help from the U.S. military, asking the president to mobilize the Army Corps of Engineers to add medical facilities and ensure hospitals are able to care for the patients that may flood in.
I think making those preparations is a good idea now in case we might need them.
And now doctors are pleading with people, if you are one of those who are hoarding those N95 masks, they're asking that you donate them to a healthcare facility. There aren't enough of those masks, and they say they are critical to them being able to take care of people as this outbreak continues. George?
That is so important. Okay, Eva, thanks very much.
Well, hey there.
Okay, and there you go on that video and that report. And that does it for this evening edition of the Riley King Newscast right here on the Riley King Network. I hope you all have a great rest of your Monday evening, and thank you for watching. And join me later on this evening for a special broadcast of 2020 COVID-19 coronavirus outbreak. Good night, and see you later on for the special broadcast. And I'll see you back here in a little bit for a news report. Goodbye, everyone.